Hi, imagine being in a state where you cannot flex, move properly, run, or even walk to a nearby place where you need to go just now. It's hard not being able to do certain things because of being obese. What if you have insulin resistance? What is insulin resistance? What kind of animal is it? Is insulin resistance bad? If it's that awful, why not get rid of it? Can it even be reversed if at all there is such a thing? What are the effects of having insulin resistance? Are you willing to get rid of insulin resistance if it's that dangerous? Why should you even care? The consequences are so problematic and hard to deal with. You are about to find out in a moment. Hi, you are live to Health Need, where we provide you with up-to-date scientific research information on health and fat metabolism. You are rest assured that you will enjoy being aware of your health.
Most people think it does not affect them. They say it's only for diabetes patients. If you are not familiar with insulin, you are maybe surprised that lack of it is hazardous to your metabolism.
First and foremost, what is insulin resistance and how does it come about? Insulin resistance is loss of the cell's sensitivity to insulin resulting from incessant glucose spikes over time. Regardless of whether you have diabetes or not, insulin is there to do its job. Why do you think those having diabetes cannot do without it in the first place? It is the same reason you need insulin. What is insulin? Insulin is a hormone meant to maintain homeostasis. In this case, the level of glucose to a certain standard depending on the person's genetic makeup, age, activity, gut microbiome, etc. Where does insulin come from? Insulin originates from the pancreas, particularly from cells known as islets of Langerhans. The pancreas is an organ just underneath the stomach beside the duodenum, subdivided into 3 categories of cells. They include delta cells, alpha cells, beta cells. These cells release essential hormones including insulin. The delta cells secrete a hormone known as somatostatin. It is responsible for inhibiting other hormones produced from the islets of Langerhans, yet to be mentioned in a moment. The alpha cells release glucagon. This hormone raises the level of glucose in the bloodstream. It helps stored glycogen to turn into glucose in the liver and muscle in a process called glycogenolysis. Beta cells produce insulin. Insulin reduces the amount of glucose in the bloodstream. Glucose is converted into glycogen in the liver and muscle in a process known as glycogenesis. What exactly does insulin do? It binds on the receptors of the cells. This allows the pores to open and thus entry of glucose. It communicates with these receptors for this to occur. We discussed what insulin is, where it originates, and what it does. Yet to be revealed is what insulin resistance is, dangers involved if you are insulin resistant, and how to combat it. Before we talk about what insulin resistance is, you need to know what happens when you eat certain types of starch foods like rice, bread, and other carbohydrates like milk, which contain sucrose. What happens when you eat carbohydrates? Glucose is elevated. When this happens, the level of glucose has to be regulated. Thus, insulin is released from the pancreas and it begins doing its job. What if you eat a high-carb diet incessantly during the day and every day? Over time, you may develop insulin resistance, and the reason, too much of anything is bad. Are you willing to face that? What really happens at cellular level? The cells are staffed with glycogen and fats all the time, and hence cannot allow any more entry of glucose. Over time, the receptors lose sense to insulin. Now, even if the amount of glucose was to reduce to normal in the bloodstream after being used by other non-insulin resistant cells, you would still have insulin resistance. The fact that you have insulin resistance means that you are either on the way of having diabetes type 2 or you have one. The question is, are you aware of what you are getting yourself into? If you are insulin resistant, you may be pre-diabetic without knowing it yourself, but having diabetes that way is easily preventable. You have to work on insulin resistance. How would you know you have insulin resistance in the first place? If you have the following: frequent hunger, cravings, weight gain, skin tags, high blood pressure. How would you fight insulin resistance whether you have diabetes or you are pre-diabetic? There are certain methods that have worked for some, but not for everybody. Are you ready for this? If you have tried doing that, have you lost weight at all? Maybe not. Well, are you ready to go for a scientific approach that guarantees results? Have you prepared yourself to get rid of excess fat? Subscribe now and get the best way to tackle insulin resistance. Why procrastinate if you have at your fingertips what solves your unsolvable problem? Get yourself a free spot now.